Good evening, everyone. My name is Rachel Lucy, and I stand firmly in negation of the resolution that the US government should implement a higher sales tax on junk food and sugar-sweetened beverages. This argument is structured around three main points. One, a sales tax on junk food and sugar-sweetened beverages will disproportionately impact individuals with lower incomes and cause them more harm than good. Two, the sales tax will not have enough of a positive impact on health to warrant its costs. And three, introducing these sales taxes limits individual freedoms. First, this proposed sales tax will primarily impact individuals with lower incomes and harm their well-being. People in poverty are constantly thinking about how they're going to spend the little income they get. They need to carefully budget to pay various expenses such as housing costs, childcare, and taxes, which leaves very little wiggle room when it comes to income that can be spent on food. One of the benefits of processed or unhealthy food is that it has a longer shelf life, allowing families to save food for the future, and the cost of these foods are much lower than that of healthier foods. According to Dr. Kern, the lead author of the study in the International, Journal of Environmental Research and Public Health, stated that on average, healthier perishable foods were nearly twice as expensive as unhealthy packaged foods. He studied the effect of pricing healthy food at different rates on purchasing habits of individuals and found that changing the prices had the lowest impact on those in the lowest economic groups because even at its most affordable, healthy food was just too expensive. This means that likely the only way a sales tax would be effective at getting people in poverty to eat healthy would be to double the price of the foods to match their price, which is unrealistic, harmful, and there would still be those who still wouldn't be able to purchase healthier food. This is because, according to American Diabetes Association, 43% of households below the poverty line are unable to access healthy food. Many people live in areas where only junk food is available, and these areas are called food deserts, which the US Department of Agriculture defines as urban neighborhoods and rural towns without ready access to fresh, healthy, and affordable food. They estimate that this affects about 23.5 million US citizens. People living in food deserts have no choice in the food they have access to, so raising the price of unhealthy items just means raising the price in general, forcing them to have to either increase their food budget, which will force them to have to forego other payments such as housing and child care, or they will eat less, and this may result in many going hungry or starving. My second point focuses on the fact that despite the purpose of junk food and sugar-sweetened taxes primarily being to promote health and address obesity, it is not effective at accomplishing that. While it's intuitive to suggest that taxing junk food will promote fewer purchases of these items and increase substitution with healthier alternatives, there's a difference between what works in theory and what works in practice. A study published in the Journal of Entrepreneurship and Public Policy conducted by Dr. Hoffer states, buying habits do not change markedly in response to higher prices, and the burden of these taxes falls most heavily on those in low income, who allocate larger shares of their budgets to food than wealthier people do. This means that those with higher incomes aren't as concerned with raises in prices because spending a little more does not have a huge impact on them. But if some are persuaded by the increase in prices, that does not mean they substitute with healthier food. According to Nadim Ismail at Fraser Institute, junk food taxes don't guarantee a reduction in overall caloric intake, and consumption may be unresponsive to price changes because individuals may switch to other non-tax but still energy-dense items. Even if taxes were efficient at preventing people from eating unhealthy food, this would not solve the issue of obesity. Obesity is not simply caused by eating unhealthy food. Other important factors contribute to this chronic condition. According to Dr. Foster at the University of New South Wales, obesity has deep social and psychological reasons for existing, so trying to treat it with a facile monetary lever will probably end up making people who are suffering right now suffer even more. My third argument is that a sales tax limits personal freedom of choice. If we want to lower obesity in America, we need to better inform citizens, not force them to comply. An article by NBC stated that New York City decreased adult sugar-sweetened beverage consumption by 35% and decreased high school consumption by 27%, not by imposing a tax, but by pursuing a campaign intended to educate the public on the harmful effects of overconsumption. Simply taxing people is not enough. US citizens need to be allowed to make their own decisions, and Americans have made up their mind. They are staunchly opposed to the imposition of sugar-sweetened beverage taxes. This was in a finding in a survey conducted by Dr. Golst on Americans' opinions of policies aimed to reduce sugar-sweetened beverages consumptions. It found that 65% of people responded favorably to calorie labeling, which would afford greater choice to the consumer, but 76% opposed sugar-sweetened taxes. That while we can increase resources to provide Americans with access to healthy food and information about foods and their effects, it should be up to them, not the government, to choose. To do otherwise would be undemocratic. In conclusion, because a sales tax puts unfair hardship on individuals with lower incomes, the sales tax will not have enough health benefits to warrant its cost, and because introducing these sales taxes limits individuals' freedoms, I ask you to rule in favor of the negation. Thank you.
Okay, we will begin with second round of crossfire.
Moderator, are you ready?
Yes.
Negation, are you ready?
Yes.
All right. Referring to a story, you referred to a story from Dr. Gullis who made the argument that Americans are in favor of caloric labeling instead of a tax. We already have had these labels since 1994, and we also had many education efforts to no avail. What makes you think that more information will suddenly be successful?
Well, like I said, I also cited a study that was conducted of that same kind of like education based system in New York City, and that was very effective. It reduced consumption by about 30%. So education in other healthy habits such as exercising and giving people access to healthier food would be much more efficient at reducing obesity than punishing people.
Thank you. You introduced a study by Dr. David Kern and conclude that the only way for it to be effective is to double the sales tax. Are you aware that one of the authors of the study claimed the exact opposite conclusion?
No, I am not.
How do you explain the discrepancy between your interpretation of the study and the author's conclusion?
I only know what I found in that article, and the doctor I cited said that he found that those with lower incomes were, no matter what the pricing of healthier foods, were still not able to afford healthy foods.
He says, and I quote, cheap prices of unhealthy foods relative to healthier foods may be contributing to obesity and low quality diet. So that means specifically that reducing the gap will help the low quality diet.
Yes, I do agree that reducing the gap would help, but I'm saying that they also said that no matter what, having healthy foods at the prices that they're currently at is just an unreasonable price, and sugar taxes won't increase enough for people, like you said, people who in low incomes are the ones who are most affected by obesity. They're still not going to be able to afford healthier food, and some will still not have access to healthier food because they live in areas such as food deserts.
In Hungary, we saw manufacturers reformulate products to be healthier so that consumers would not have to pay the tax. Why wouldn't this happen here in the US?
Could you repeat it again? I couldn't quite hear you.
In Hungary, we saw manufacturers reformulate products to be healthier so that consumers would not have to pay the tax. Why wouldn't this happen here in the US?
Well, we could start by having the companies like be forced to use healthier products, but I don't think that consumers should be punished for not having access to healthy food at the moment.
And you quoted Nadim Ismail from the Fraser Institute. What type of organization is that?
It's a university. They did research.
No, it's a political advocacy group funded among others by the company that created the artificial sweetener aspartame marketed as liquid sweet.
All right, well, that is time for crossfire. Thank you both. It is getting a little bit spicy in here. Maybe we do need some sugar to even things out. With that being